Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Today we're going to discuss the interaction between commonly prescribed high blood pressure treating medications and your immune system. And it's a very important, critical discussion we need to have because we're heading into the fall and winter, and up here in the Northeast it's the height of the infection season. Cough, cold, flu, and of course COVID-19 still hanging around. But before I begin, high blood pressure is incredibly dangerous. It can wreck your brain, it can damage your eyes, it can damage your kidneys, and of course it damages your heart, and it can lead to conditions such as sudden cardiac death, atrial fibrillation, and other arrhythmias, which are improper beating patterns of the heart attacks, strokes. It even increases your risk of Alzheimer's disease. So high blood pressure is really dangerous. And taking any high blood pressure treating drug is safer than having high blood pressure. These drugs definitely save lives, so I'm not against them at all. But they do deplete important nutrients, many of them deplete important nutrients that are needed for your immune system. This doesn't translate to dropping the drug. What it means is you have to replete the nutrients. And frequently, you're really not going to get enough from your food. And this is especially true for older people, which are the people who tend to have high blood pressure. So welcome to my episode, High Blood Pressure Drugs Deplete Important Nutrients Needed by Your Immune System. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. We're going to discuss over the course of this episode which drugs deplete which nutrients, what these nutrients do for your immune system, and simply how to get them back into your body so you'll be safe this winter. So thanks for tuning in to today's Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. And please subscribe and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. The information on this episode is linked at the episode description, so I really want to get going. So your immune system, it's one of its major jobs, besides fighting cancer, besides repairing things, is fighting off infections. And people with poorly functioning immune systems, infections become much more dangerous. So there's a number of nutrients that are key to good immune system function, like vitamin D. You need vitamin D to create immune cells. In fact, it's so important to your immune system that your immune cells can actively activate. They can actually activate vitamin D. We once thought vitamin D could only be activated by your kidneys. Now we know that your immune system can activate it. So vitamin D is needed to make immune cells and for immune cells to work, but also to protect us from the infection and our own immune system. And a perfect example of that is what's happening with the COVID-19 pandemic right now. Most people who die from COVID-19, it's because it's destroying their lungs. So for whatever reason, the COVID-19 is raging in these people. They have massive number of virus cells floating around their body. It's getting into their lungs and causing viral pneumonia. And what happens is, which inflames the lungs, by the way, and there's a backlash from the immune system. You've heard of the cytokine storm. That's one of the terms that's become part of our language because of the COVID-19 pandemic. You've heard of the so-called cytokine storm. So our immune system starts to release inflammatory factors like interleukin-4 and interleukin-6 in the lungs, and this leads to acute respiratory distress syndrome, which means the lungs are basically flooding with fluid and you can't breathe, so you put on oxygen or you put on a ventilator, and that's a terrible sign for survival, that you put on a ventilator. So you need vitamin D to create immune cells, for immune cells to work, and to protect yourself from your own immune system. You also need vitamin C. It's very interesting. Northwell Health, the hospitals out here in Long Island, when people come in with severe COVID infections, they're giving them infusions of vitamin C directly into their blood. That's intravenous. And that's because as soon as an infection is riling up the immune system, your nearby immune cells soak up all the available vitamin C to get to the point of infection. But they also release vitamin, that's called chemotaxis, by the way. They also need vitamin C to release their arsenal of weapons to kill the virus. That's called respiratory storm. That's called a respiratory burst. In any event, and a lot of these people come in pre-inflamed. Maybe they have high blood pressure, maybe they have diabetes, maybe they smoke, maybe they're very obese, they're already inflamed. The virus furthers the inflammation. If it gets into the lungs, this is quite dangerous, and then the immune system finishes you off. So you need vitamin C to your immune cells to the site of infection, and you need vitamin C to help kill the viruses. And then there's zinc. Zinc is commonly depleted by high blood pressure medication. You need zinc to create immune cells. You need zinc to create antibodies. Antibodies are formed on your B cells. And antibodies have these two chains, alpha and kappa chains, that fit a particular virus or bacterium like a glove. So, for instance, they give you a flu shot against particular strains of the flu, and then you make specific antibodies that fight those strains of the flu. So you need zinc to create antibodies, and you need zinc to create other immune cells. You also need zinc for them to function and to get to the infection and kill it, because zinc will actually be used by immune cells to overload viruses. That's very interesting. We can take a lot of zinc, humans, and we don't hold on to it. That's why you basically need to get zinc every day. We don't really store zinc. But your immune cells can load themselves with zinc. That tiny bit of zinc does nothing to us, but it'll poison the viruses by overloading them, and it'll poison bacteria. Plus, zinc kind of gives us a Teflon coating. It makes it hard for viruses to attach to our tissues. Studies show that elderly people who are commonly low in zinc, they have a higher risk of infections, especially pneumonia. Like studies out of Africa show that children in Africa who are low in zinc, very commonly they get these intestinal infections that cause severe diarrhea, which is terrible because they get dehydrated. It's dangerous, actually. So zinc is one of those things you need for a competent immune system. For instance, they show that people who take a lot of zinc, when they first developed the symptoms of a cold, they get better a lot faster, and the symptoms are a lot milder. So you're sick for less time, and you're a lot less sick than you would have been. And then the last one is melatonin. Melatonin is known as the nighttime hormone. You release it from the pineal gland, sort of in the middle of your brain at night when it's getting dark, to set you up for sleep. And you need melatonin to sleep deeply. And you need melatonin to sleep deeply and to sleep long enough to get a really good, refreshing sleep. But melatonin does a lot more than that. Melatonin is needed to build bone. Melatonin adjusts your nighttime blood pressure. If your blood pressure remains high at night, in the morning you release a gush of stress hormones that raises your blood pressure even more. That can be quite dangerous. Your blood pressure is supposed to drop 10 or 20 points at night when you go to sleep. If it doesn't, it's already a little elevated as far as your body's concerned in the morning, and then you release the stress hormones, which squeeze your blood vessels and make your heart race to wake yourself up to get enough blood to your brain and muscles so you can wake up. But then your blood pressure could zoom, and that's why waking up in the morning is the most common time that people have heart attacks. So melatonin lowers your nighttime blood pressure, but it also lowers your nighttime body temperature so you could sleep at night. A good reason to keep your windows open at night. Now, melatonin also has important functions in your digestive tract. It might even help GERD sufferers and people with diseases of the digestive tract. In fact, it's so important to the digestive tract that now we know your digestive system can release melatonin for proper function. But also recently it was found out that your own immune cells can release melatonin. So we once thought only melatonin was expressed from the brain. Expressed means released. We once thought that you only express melatonin from your brain to sleep at night. We now know that immune cells release melatonin so they could kill cancer cells and viruses and bacteria and other infectious organisms. But also melatonin is needed for your circadian rhythm. Your circadian rhythm is your internal body clock, something that you kind of lose control of with age. And if you're not sleeping at night, that affects your immune system in the daytime. See, at night, you're pretty much sleeping at home with your loved ones in your own bed. So you're not out shopping, you're not at work, you're not a busload of people. So the immune system doesn't have to be as active. So the immune system gets a chance to kind of heal itself, to take care of itself, to relax at night, to get a little rest. In the daytime, when you're out shopping or you're on a crowded train or you're mixing it up with people in the supermarket, that's when you really need your immune system to function. If your internal clock is off, which is one of the things that happens with age, your immune system isn't functioning well in the daytime when you really need it to protect yourself. So melatonin is really important. So here's one study to give you an idea of what I'm talking about. It came out July 29th, so it came out very recently. Common blood pressure drugs leave your immune cells weak against bacteria. So they're looking at, it's the American Association for the Advancement of Science. They're looking at ACE inhibitors. These are extremely commonly prescribed drugs, very commonly prescribed drugs. They inhibit an enzyme from being activated that's released from your kidneys, and this relaxes your blood vessels. So when your heart pumps, it's easier to pump blood up to the brain and down to your toes, etc. So the heart doesn't have to pump hard. Pumping hard is high blood pressure, so your blood pressure goes back towards normal. So millions of people are described ACE inhibitors, which stands for angiotensin converting enzyme inhibitors. They use it for high blood pressure. They use it for heart failure. They also use it to protect your kidneys because they also have that effect. But they can weaken the immune system's ability to fight off infections, like serious bacterial infections. So they did a study on people, and they did several studies on mice. It's in the journal Science Translational Medicine, July 28th. So here's what they did. They studied ACE inhibitors, but they also studied Arbs. Arbs are similar to ACE inhibitors, but I like them better. Arbs stand for angiotensin receptor blockers. The ACE inhibitors block an enzyme from being activated. The Arbs prevent it from going to where it has to go, where it works. So they both work in a similar way, and they both relax your blood vessels and reduce your blood pressure and protect your heart muscle. So not only are they used for high blood pressure, they're used for people with heart failure to prevent further damage to the heart and further erosion of heart function. But they also protect your kidneys, and they lower your risk of Alzheimer's disease. That's all good. Plus, a particular ACE inhibitor called losartan also lowers your uric acid. Normal, middle level amounts of serum uric acid are dangerous when you have other heart risk factors. So your uric acid could be in the middle of normal, according to your doctor and according to your lab, but it'll increase your risk of a stroke or a heart attack if you have other risk factors for heart disease like diabetes or obesity, or you smoke, or you have severe high blood pressure. So the losartan in particular has a bundle of activities that protect your heart, protects your kidneys, protects the heart muscle, lowers your blood pressure, lowers your risk of Alzheimer's by something like 20 to 25%, and lowers your uric acid by about 20%. So here they're looking at Arbs versus ACE inhibitors. And once again, the ACE inhibitors are the ones in this study that have been shown to have an effect, a bad effect, on your immune system. So it's a Dr. Zakir Khan. He's an associate professor at Cedars-Sinai Medical Center in Los Angeles. He's the senior author of the study. And they're finding out that giving ACE inhibitors in these mouse studies really affects the immune system. These drugs are thought to be very safe. So they noted that there are studies finding an association between ACE inhibitors and some forms of infection, according to Dr. Kahn. So he wanted to further explore, is this association real? So they treated mice with the ACE inhibitors, like Altase, which is ramipril, or lisinopril. They're very commonly prescribed. And they tested whether their neutrophils could kill very serious bacteria, killer bacteria like MRSA, methicillin-resistant Staphylococcus aureus, or Klebsiella pneumonia or Pseudomonas aeruginosa. I mean, these things cause all kinds of infections. They cause pneumonia. And they found that the neutrophils were much weaker when you were on ACE inhibitors. Now, that's important because ACE inhibitors are some of the first cells to kill a virus or bacteria, and they're the lion's share of your white blood cells, and they're in places important where your body comes into contact with viruses and bacteria. So they're in your nose, they're by the tear ducts of your eyes, they're in your mouth, they're near your lungs, they're in your stomach and intestines, they're by the urinary tract, by men's prostates, and they're near your skin. So these are really important cells. So the neutrophils were much weaker in killing these bacteria when you were on an ACE inhibitor. So they also they also use ACE inhibitors in people with heart problems who might be vulnerable to an infection in the heart. So they also found mice with damaged heart valves, and that was really scary because, once again, they couldn't prevent infections, the type of infection that would get inside your heart. Now, when they tested Arbs, like losartan, which is Cozar, which if that drug works on you for your high blood pressure, to me that's the best high blood pressure drug. It didn't affect the immune system. It didn't inhibit the ability of your neutrophils to fight infections. So they did a human study, a small clinical trial, a pilot study. A pilot study is to see should we go further in the research. And they gave a bunch of humans the same ACE inhibitors, and the same thing happened. They found when they took their neutrophils, they were terrible at killing these infectious organisms. So what's going on? Part of this might be a serious depletion of important nutrients. So nutrients that are really important for your immune system. So this is the International Journal of Clinical Practice. It's the Department of Pharmacy, the Alfred Hospital, that's in Melbourne, Australia. And they found, yes, indeed, many high blood pressure drugs depleted zinc. Like ACE inhibitors definitely depleted zinc. So did a lot of commonly prescribed diuretics. Diuretics help get rid of extra salt. They work in the kidneys and different parts of the kidneys. And they help get rid of extra fluid and salt, and this takes a lot of pressure off your heart, and your blood pressure goes down. So they found hydrochlorothiazide. That is so commonly prescribed for high blood pressure. And furosemide, which is Lasix, which is a very powerful diuretic, both caused a loss of zinc. But that's not all they caused a loss of. So let me go over some of the things that these drugs are causing you to lose. The ACE inhibitors, like lisinopril, which is also called Prinivel, cause you to lose zinc. Now, diuretics like hydrochlorothiazide, which is probably the most commonly prescribed diuretic, you lose both vitamin D and zinc. Now, that's not the only thing that you're losing, but these are the things you're losing that you need for your immune system. Beta-blocking drugs like atenolol or metoprolol, you were losing other nutrients too, but you were losing melatonin. You need melatonin for your immune system. Loop diuretics like furosemide, which is Lasix, or ethacrenic acid, which is Edicrin. You lose both vitamin C and zinc. So there's a real need for supplementation. I'm not saying you have to get off the drug. I'm saying you need to get the supplements into your body. Calcium channel blocking drugs like amlodipine, which is Norvasc, or felodipine. There's a whole bunch of them. They deplete vitamin D. Potassium-sparing diuretics. They give these commonly to people who've had a heart attack with heart failure to lower their blood pressure and protect their heart. They deplete magnesium. So what's the issue with magnesium? You cannot activate vitamin D if you lack magnesium. So this is dangerous. But it's more complex than that. It's not just that the drugs are affecting the immune system. So is the time of year. And this is really important to know that. The drugs are depleting important nutrients like vitamin D and zinc and vitamin C that you need for good immune system function. But they also found in a number of studies that there's seasonal variations in these same important nutrients. In other words, your zinc levels start to fall in the fall, probably because you're using it up for other things, because zinc is needed to protect your brain and your heart, and it's needed for your immune system and all. So you're probably using it up quickly. So the drugs are lowering your zinc, and because we're going towards winter, that's also lowering your zinc. And the problem is you need zinc for the immune system to fight infections. And vitamin C drops in the winter. You need vitamin C to fight infections. And vitamin D levels drop in the winter. But they're also lower in elderly people. It's very common for elderly people to be low in zinc because they have trouble absorbing zinc from their food. So zinc levels commonly fall in older people. But then the drug further lowers the zinc, and then it being winter, it's further lowering the zinc. And it's very important to bring zinc levels up in elderly people. It's critical because their immune system isn't working as well as it used to anyway. So here's my recommendation. Don't mess around. If you're on drugs for high blood pressure, make sure you're getting zinc. Make sure you're getting vitamin D and get D3. That's the one that works the best. I would say about 2,000 to 3,000 units a day, and always take these with food to improve the absorption. You need zinc, you need vitamin D3, you need vitamin C, and if you're on beta blockers, you're probably going to need melatonin also. In any event, you don't have to drop the drug, you have to get the supplements, because getting your blood pressure under control you need that for survival. So thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Please subscribe and review. Leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you next time on another episode of the Invite Health podcast. Thank you so much for listening. And this is Jerry Hickey signing off.